When I was young, I lived in a predominantly African-American community, and we only had one African-American dentist in that community of, I don't know, 200,000 people. It was a big problem.
I became interested in dentistry because I saw that there was huge health disparities that exist in minority communities.
As we look at the data today, 13 to 15%, depending upon which surveys you want to look at, of the population are African American. Another 13 to 15% are Hispanic. Yet at the same time, less than 3% of practicing dentists are African American or Hispanic.
Through this program, students were able to get essentially 6 weeks of experiences outside of the dental school in clinical settings that were different from what they were used to in sort of the ideal situation of the dental school clinic. One of the other things that happened was that students who had not had a lot of experiences with other populations found that they really enjoyed treating patients from different populations. And it changed the way that they looked at society and other people.
I'm Mexican American. I came from a very poor background myself. It is a privilege to help these people that otherwise would not have any other means of getting comprehensive care. You know, in my case, when I get to speak to my patients and they only speak Spanish.
¿Por qué? ¿Cómo te llamas?
Gilberto.
Gilberto, mi amor. ¿Y por qué estás bien malo hoy? ¿Estás nervioso?
It's a huge difference. I mean, I could see that connection that we make.
For the most part, dentistry is looked at as a lucrative field, something that you're going to go into it for money, and having this program gives them the opportunity to maybe consider working in underserved communities. I feel sometimes that I have my own personal mission to try to expose my classmates to underserved communities and explain to them the cultural differences that exist.
I've experienced it firsthand, and I know how hard it is for underserved populations to have access to affordable dentistry and to be treated, if they choose to be treated, by people that are like them. Of course, I've had countless patients that are Caucasian or Indian or Chinese, and I mean, they just look to me as if I'm just another doctor, but it's when I have African American patients that it's a big deal.
A lot of what this pipeline project has been able to do is to highlight those best practices that bring in underrepresented minorities into dental school. And we've seen significant rises in those schools in the pipeline program. This is a very exciting time for dentistry and for dental education. Patients want to come in general to get their dental care. They understand the value of a smile. The pipeline project represents one of the most important, if not the most important, change in the way that dental education is provided and the way that future dentists are going to be educated in this country. This project is going to have an impact for generations to come.
My plans after graduation is to actually apply to a federally qualified health clinic here in the city of Chicago. I definitely want to make a large impact in my community, so this is where my heart is at.